Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the world, the global world, as of September 27th, 2020. As you know, this disease began somewhere in late 2019. Early on, there hadn't been many deaths, but then week on week, as you can see, the death rate around the world has grown considerably and consistently, such that by last Thursday, 987,000 deaths have been reported and 32 million cases. And as I've said many times, this is a tremendous underestimate because there are many parts of the world that don't have the capacity to report week to week on the number of deaths. And often for pandemics, we don't actually know the total death rate till afterwards when we look at something we would call the excess death rate. There's been about a 4% increase in the total number of world deaths over the last week. It's important to remember that this isn't a pandemic that's exploding equally everywhere in the world. There are countries like Belgium, France, Italy, Spain that saw a very quick growth rate and then have seen leveling off of that growth rate over time. Conversely, there's countries like the United States, which appears to be slowing down, and then countries like Brazil and India where the growth rate is continuing to go up. If you look at it globally, the pandemic started in China, then seemed to spread to Europe, North America, and to Asia, to South America, Africa, and elsewhere. By the end of April, it was pretty much everywhere in the world. On April 27th, the top 17 countries in the world were these. That was about 5 months ago, about halfway between then and now. On July 5th, this was the list. And then this week, this is the list. And the number next to it is deaths per million. So you divide the total number of reported deaths in a country by a million population. And the reason I want to show you this is twofold. First, to show you how the pandemic is spreading. Back in April, virtually all the countries that were most heavily impacted were in Europe. The ones in blue are North America, and the ones in red are Central and South America. And what you can see over the last 5 months is that this has gone from being primarily a disease that's impacting Europe to one that's largely impacting South America and other parts of the world. But the second thing I want to point out is how much the numbers continue to grow everywhere. So 5 months ago, the U.S. had 166 deaths per million. We're now about 4 times that number, 628. In fact, our number today would have been the worst in the world on April 27th. Conversely, you can look at countries like Peru that weren't even on the list 5 months ago. We're in the middle of the pack, middle of the top 17. In July and are now the worst in the world. So this is a pandemic that's growing everywhere, but it's growing more quickly in some parts of the world than others. This shows you that in the early months, it was mainly in Western Pacific, China, then Europe, the green, and then the Americas in orange. But now we're starting to see growth in Southeast Asia and other parts of the country, other parts of the world. And I suspect what we'll be seeing over the next few months is continued growth in all the places that have been impacted, but especially spreading into those places that haven't been so heavily impacted. This is a list of the 25 worst pandemics in recorded human history. So about in the last 2,000 years, what do we know about infectious diseases that have spread around the world and caused significant numbers of deaths? And there's COVID-19, 24th position. And you can think about that as well. Maybe that's good or it's not so bad. But really, if you think about it, almost 1 million deaths in less than a year is pretty significant. There are 3 of these pandemics that are still ongoing now. There's tuberculosis, which has been hitting us for the last 200 plus years. The HIV/AIDS pandemic, which is in its 30 some year, actually going on 40th year now, and then COVID-19. The reason I highlight these is that tuberculosis kills about 1.5 million people a year. AIDS kills about 1 million. And if the current trend with COVID goes on, it'll be about 1.25. So you get a sense this is a really serious pandemic, even on global historic standards. And if you look at how many pandemics there have been that impacted about 1 million people, you'll see that COVID is going to very quickly be be a top 20 pandemic in recorded human history. So this is a serious infectious disease that's spreading around the world. It continues to be a major threat to health and public health, and it's something we need to continue to take seriously. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to this mailing list, please contact Jan Stork. I'd like to thank Melissa White for updating this week's slides and Dara Young for editing, producing, and posting them. As always, if you have any questions or comments, or there are any topics you'd like to see us address, please let me know. I look forward to hearing from you. Thank you very much.